We've received benefits from the Grant County, Silver City area, Income Support Division, the Northwest Albuquerque, New Mexico Income Support Division, and the Southwest New Mexico Income Support Division.
Currently, we're at the Northwest ISD office.
I go to the Southwest Bernalillo office.
We go to the ISD office in Gallup.
The Southeast office.
I go to counselor office.
I've had problems in all of the offices.
Both my children, Jody Lynn and Caleb, are on Medicaid. Salute.
I receive food stamps for all of us, and then Medicaid for my 3 kids, and family planning for myself.
The reason my son needs his Medicaid is for the 3 holes on the bottom 2 chambers of his heart.
I had to wait for my son to get surgery for his ears from December 2006 until April 2007 because his Medicaid expired.
We've had problems with auto closure of our children.
Auto closure is a process whereby the computers of the state automatically close children.
Auto closure is something I see all the time.
Auto closure is when a client comes in for their renewal. They bring in all the documents needed to apply for the Medicaid that they're applying for. That gets submitted on time before the end of the renewal date, but the caseworker for some reason doesn't work on the case on time, and the system automatically auto-denies that case.
I believe that's happened twice since I've been receiving assistance, where I've just been cut off after recertification, and I had to go in there the next week to try to figure out what happened, and was told that I hadn't turned in one paperwork that I knew that I did, and sitting down with them going through it, I did turn in, it was a bank statement in one case, and I don't remember what the other one was.
Well, first, we did everything they asked us to, at least in paperwork-wise, and we didn't know why we were cut off. There was no explanation, it just said there's closure.
I see anywhere from 25 to 50 people a week that have been kicked off of Medicaid, but they are Medicaid eligible.
At the lowest month, 10% of our kids are closed, but I haven't seen a good 10% number in a very long time. This last month it was 18%, and it's been pretty consistent at 17 to 18%. Sometimes it's as high as 20% of our children that are getting closed.
Specifically in our clinic, we've seen from 85% being covered by Medicaid now to 75%.
There's this perception that it's only a few people who are being affected, which is so untrue.
They come to us with their renewal, they bring in all the information, and then they get a letter saying that they were auto-denied.
I would say maybe 70% of them are here because they're seriously ill or sick.
A lot of the patients that I see require medication on a monthly basis, but if they've lost coverage, then they can't afford the medication, and so they've lost the medication that they need to treat their condition.
The parents go to the pharmacy, and at the pharmacy they do say if they don't have Medicaid, they have to pay cash. So often enough, the special needs children need medications that are very expensive, and so parents happen to not have that money, and they will not buy it, and the child may end up going back to urgent care or the emergency room.
We get patients in here every day that still think they're on Medicaid.
I found out that I didn't have any Medicaid because I called to do an appointment for my kids, because the baby one, the one she's a year and a half, she was sick, and I called to see if I can make the appointment by that day, and they said that I got a call to my caseworker because she didn't have any Medicaid.
I have to reapply in certain months, and they don't explain to me what I'm applying for and what papers I'm getting from them. They just send me papers that I don't really know of. And when I go back and ask, they tell me that, well, you're supposed to call us right away, which I don't have a phone, so it's hard for me to call them, and I have to actually go to their office to make an appointment or talk to them, and usually those days that I have off, they're not available.
I know it takes about 3 times to call a caseworker, and I generally have to say, this is an emergency, I have an emergency situation.
I called for a whole month straight to my caseworker and still got nothing back. I had to call and talk to her supervisor in order for somebody to call me back.
Half the time, they wouldn't answer phone calls.
Sometimes I can't even get a hold of the caseworker, and I would say that's like 90% of the time all I get is voicemail. So it's like you pray that you get a phone call back.
I applied for Medicaid in July of 2005, and I was not contacted either by mail or by phone.
They lost my file, couldn't find it, didn't know who had my case. Neither one of the offices wanted to help.
The other thing is they bring the paperwork, they get their receipt, but then they don't hear from them, and then when they hear from them, it's a denial letter. They have to bring the paperwork again and get another receipt. And that takes like 2 months to 3 months.
And the caseworker has said that they were denied because they did not turn in all the documents, and they were sent a letter stating what they needed. And the client says they've never received those letters.
I've been living at my apartment for 6 years, so I didn't know if it was probably my mailbox, but I don't think so, because I always receive like letters and all that from, I get my bills.
That's when she informed me that the reason supposedly why I hadn't been contacted was because my address was entered wrong. So the mail was going to an address that didn't exist.
We find that letters don't consistently arrive when they should, even for people who have consistently been at the same address.
Since that happened to me, that my son wasn't approved for Medicaid, or that day he wasn't on Medicaid, and they told me that I didn't bring in papers in, that's when I started to save all the documents, because I got tired of them telling me, well, you didn't bring this paper in, or you didn't show up for your interview. So I tried to just get all the documents saved.
I've been taking my papers from my pay stubs and all that, because they lost the papers. They say they don't have them, so I take them more than once.
My clients have gone in, had all their paperwork, everything that was asked of them, and their cases were still closed.
Your families have turned in their paperwork on time, and with significant struggles. Again, these are families who, by virtue of living in poverty, they have multiple challenges, and it's probably the hardest for them to get organized to do this. And but they do it.
I don't blame the case managers or even the supervisor. I understood that they're short-staffed, and the paperwork was piling up, and people were just being automatically closed.
You have to be really methodical and determined and focused, much more than I have to be, for instance, to maintain my insurance. Much more.
And I would say the vast majority of people will do it on time, will try to comply. They recognize the importance of having the Medicaid coverage for the kids.
This is a right of every child who is eligible by income to have. And we're just asking for that.
To have a system that automatically closes children from that safety net, what should be a safety net for children, is unconscionable. And we have that practice in New Mexico.